Hi, my name is Francine Poole, and I'm here to talk about cost analysis of healthcare. Presently, the cost of healthcare in the U.S. is growing at an unsustainable rate. The patient outcomes are poor in spite of the rising cost. According to the Kaiser Family Foundation report in 2012, the United States healthcare system is ranked as the most expensive in the world, with 48% more cost per capita than the second-ranked country of Switzerland. Preventing waste and fraud in healthcare could save billions of dollars. According to U.S. Senator Dr. Tom Coburn, approximately $150 billion a year are wasted on fraud. One measure that could help contain the cost of healthcare is the implementation of patient-centered medical homes, or PCMHs. In a study by Michael Ewing of the University of Alabama in Tuscaloosa, the PCHM model of care focuses on care coordination and the development of long-term physician-patient relationships that are expected to lead to a better quality of care and higher patient satisfaction rates. The World Health Organization believes that primary care is integral to maintaining an individual health and identifies functions of primary care providers, which include, number one, to address the health needs of the community, number two, to educate the public about health issues, and number three, to provide preventative services. In 2001, the Institute of Medicine declares that patient-centered care is the main goal of the U.S. healthcare system. In 2007, the American Academy of Family Physicians, the American Osteopathic Association, and the American College of Physicians released a model of the patient-centered medical home, and this model emphasizes a physician-directed coordination of care, a whole-person orientation, quality and safety, and payment reform. I feel that this model can be implemented with nurse practitioners as your primary care providers. Nurse practitioners can provide cost-saving quality care while addressing the patient's physical, mental, and social health needs. Primary care medical homes can provide coordination of care in an organized care delivery approach, which utilizes the services of other healthcare providers such as pharmacists, therapists, and also social services. The creation of a better payment system includes adding incentives for coordinating care and providing care in non-traditional ways, such as through emails and telephone consultations. The NCQA, which is the National Committee for Quality Assurance, they have a model for the patient-centered medical home, and it recognizes 6 categories of care. One is the enhanced access with team-based care, which accommodates the patients during and after office hours. Identifying and managing patient populations through data collection, planning and managing care using evidence-based practices to treat patient maladies, tracking and coordinating patient care and care treatments and referrals with the goals of performance improvement. Patient-centered care and information infrastructure promotes the monitoring of the chronic diseases and preventative care. A patient-centered medical home is just one of the many ways to promote quality care while reducing the cost of health care. 3 things that I've learned during this course that is important. The first I'm going to talk about is medical ethics, and the 4 principles, which are beneficence, non-malfeasance, autonomy, and justice. And I learned a lot about all of these things, and through the watching of the movie of John Q, it just really opened my eyes to a lot of things that we don't normally see in some of the hospital settings. But learning these principles has increased my awareness of how to treat my patients fairly, and hopefully it's going to guide my future practice as a family nurse practitioner. And also the second thing is the importance of access to health care to all individuals. Although there's much controversy surrounding the Affordable Care Act, hopefully it can succeed in providing better access to care, which will improve the overall health outcomes. And also being active in the political arena in areas that are concerning the future of the advanced practice nurses. And I plan to join the AANP, which is the American Association of Nurse Practitioners, and hopefully that'll keep me updated on all the legislature that is going to affect my future practice of nurse practitioners. And anyhow, I hope everybody does well and succeeds in this course. Thank you.